Dr. Kimberly Fraser is the author and speaker and is a champion for family caregiving. As a nursing professor, she studied and she's written about family caregiving, home care, case management, and related health policy. Her current list of books include The Care Book, a planning and resource guide to support your journey from accidental to intentional caregiver. And I believe the release date was just this last October. The Accidental Caregiver is a wisdom and guidance for the unexpected challenges of family caregiving. And this one intrigues me a little bit. What do planes, polar bears, and pilots have to do with healthcare? The making of a nurse. Could be very interesting. I may have to look that up. And then lastly, me and my sisters, the first 10 years of Sacred Sister trips. In addition to writing books, Dr. Fraser enjoys essays on caregiving, creativity, and health. She plays with poetry, practices scene writing, and journaling. So it's with great pleasure that we welcome Dr. Kimberly Fraser.
Thank you so much. I'm reading. So if I were in a room live with you, I would be reading from my book here, The Accidental Caregiver. It's probably showing backwards for you folks. So I'm doing a reading. I'll read for about 10 minutes and have a Q&A, 10 to 15 minutes. I'm going to set my timer because I completely lose track of time all the time. So I thought what I would do is share a reading. You're all men with prostate cancer in one form or another, and maybe your partners or spouses are here, or maybe there is just some partners here. So I thought I would do a reading, and then we'll have a short Q&A, and I'll leave you to it. And if I hopefully leave you for some food for thought, maybe I'll come back one day. So I think it's a fantastic organization you have here, and I'm really honored to be a part of it. So if I were home in Edmonton, Alberta, or Sherwood Park, I would be in my office, but I'm in a bedroom in my mother's house where I'm sleeping because I flew home yesterday to help do family caregiving for my aunt she's 87 and has a lung condition. And I came home in January. I have a family of nurses and physicians, but I came home being semi-retired and we got her set up on oxygen. I left in January. She was diagnosed with prostate cancer. See, that's all I think about. She was diagnosed with bladder cancer and it's been a whirlwind. So we're family caregiving and we thought we're going to get her home. And on the plane, I heard she's coming home today. So I got up super early and blew up to the hospital saying, we're not ready. We need caregivers in place. Like there's a whole team. So it's been a busy day of family caregiving stuff in the real. And that's okay. So I wrote this book on family caregiving because my dad was diagnosed with MS when I was 18. And my mother was his primary caregiver for 21 years before he died in 2021 at the age of 64. So when dad was diagnosed, he was 43, mom was 41, and I was 18 and the youngest was 10. And dad had primary progressive MS. So it was a very intense caregiving journey. I was in my first year of nursing school and then ended up in a career out west, started a private home care company with my husband. We were under contract with Alberta Health Services for 25 years, providing very intense home care services. Our company was called We Care Home Health Services, and it sold maybe 10 years ago to a company called CBI. And at the time, my husband and I ended up, so we said, well, we'll sell too. At the time, we were very large. We had 500 staff and life was good. We loved what we did. It gave me tremendous pleasure to help families get the care they need, whether it was through Alberta Health Services or private pay or through insurance companies. And so that's a whole other story and a whole other book. So I met Richard and another man at, I think it was the Healthy Aging Alberta conference that was held in Calgary in October. So we just got to chatting and he said, I think our group might be interested. So my personal story I had family caregiving in my bones from supporting my mom look after my dad here in Nova Scotia. Dad lived and died actually in this bedroom where I'm in, as a little personal story. And we flew home to be with him. And yeah, it's all part of the life cycle. So I naturally grew into studying family caregiving. My husband's dad, we've been married for about 34 years now. We met and married in Manitoba is where, and we moved to Alberta. His dad was quite, well, not that old, like 75. That's not very old, you know, given how old we all are now. And my husband, we moved to Alberta knowing that we could go back and support him, but he died with metastatic prostate cancer in 1999, just before our son was born. So we always knew that eventually chances were my husband would have prostate cancer, but I thought it would be kind of a very subtle kind. So when I wrote this book, my husband had not been diagnosed yet. So I'm going to read you what's in the afterword. And if it intrigues you, you want more, we can talk about your journey, your family care, wives, husbands, whatever your life situation is, your children. I'm happy to talk about anything related to family caregiving, but I thought I would read what happened just when my book was being published. So I wrote this book based on what others knew and shared with me. What I studied and what I observed, not only in my own family, but also with the thousands of families I've worked with over my career as a home care nurse and as a researcher. To others, I might be considered an expert on intimate family caregiving, but you are never prepared for your own journey. Just as I was completing my manuscript, I too became a family caregiver. My personal caregiving story began September 18th, 2019, when my husband, Bim, was diagnosed with prostate cancer. Not the kind that 80% of men might have, but an aggressive type that only a small amount of men typically experience. September just happens to be prostate month, and according to the Canadian Cancer Society, every September, approximately 2,000 families' lives will be forever changed with the words they hear, "You have prostate cancer." Ours certainly was. It threw us both into a whirlwind of unknowing and fear. Often I wanted to scream. I thought of all the things I've written in this book that I would know exactly what was expected of me. I wondered, was what I wrote true? I thought it was, but now it was the litmus test. Concepts I wrote about crept into my brain. The feelings, anger, fear, confusion, the waiting for appointments, for the doctor, for lab results, for surgery bookings, for people to get back to you. The anxiety and keeping it all at bay, the search for information according to the best possible, accessing the best possible care, communicating effectively with healthcare professionals through the myriad of healthcare sectors to get the care and information we needed. It all took a lot of energy from me. Detection of a higher than expected prostate specific antigen, a PSA, in my husband's blood in the spring of 2019 set in motion a chain of events that would lead to a prostate cancer diagnosis. It is recommended that men over 50, younger if prostate cancer runs in the family, get an annual PSA check. An increased score is indicative of prostate issues, which can be anything from enlargement to cancer. And in my husband's case, his PSA had been checked annually since his early 40s, given his family history. His father died of metastatic prostate disease in 1999. Although an elevated PSA is not always cancer and can also be indicative of benign enlargement, it was not the case with us. We were immediately referred to a urologist, and in June, we were offered to take a wait-and-see approach before deciding to get a biopsy. While this is a reasonable offer, and for many prostate cancers, it poses no risk to the person, neither of us wanted to wait given his family history. Bim had the biopsy on August 21st, and we were both feeling anxious going for the results September 18th. We were led into the examining room, and then we waited. I squeezed my husband's hand. "It will be fine. He will be in a minute, and then we will know what we're dealing with," I told him. My husband shook his head and he looked us around as he said to me, "Don't talk." It was all he could deal with being there. He was doing all he could to stay calm and not to jump to conclusions. We sat there together, mostly in silence, for 20 minutes, and it felt like 20 hours. The doctor finally came into the room, and he immediately pulled a chair up close to where we were sitting, and he said, "I'm so sorry, I don't have better news." I could see my husband swallow. I held my breath. My insides began revolting. The doctor continued, "It's aggressive." The doctor waited for us to process this before adding, there were options for treatments, and he would share all of those with us. None of it seemed real. I felt like vomiting. My stomach was in knots, and I was naive, assuming that this would be as slow moving as a sloth. I felt shaky and jittery. My nervous system went into hypervigilance, and I needed grounding. And when that word aggressive entered my head, I recognized in my body signs similar to a panic attack. Not that I ever had one, but I imagined that that's what it would have felt like. My mouth was dry. I wanted to hold my head in my hands and scream. This wasn't happening to me or to us, but I couldn't. I needed to be strong, and as strong as I always was for my husband. This was our journey, but it was his body's fight. I knew I was going to have to be the one to keep him grounded. In order to do that, I needed to first keep myself grounded. I started to breathe deeply. Breathing in, 2, 3, 4, counting out, 2, 3, 4, telling myself just slow it down as much as I could. I started to relax back into my body, and I moved my feet to remind myself that the floor was firmly beneath me. We assumed that BIM would be in the same category as 80 to 85% of men with prostate enlargement or cancer, that it would be benign or at least slow growing, but we weren't. All of the questions around what we might do with a prostate cancer diagnosis were stripped away. Aggressive prostate cancer is not run-of-the-mill. The diagnosis was completely unexpected and threw us into a whirlwind of fear, both of us. Anxiety, mostly him, study, mostly me, and decision-making, both of us. There was no time to wait, but we had to. Before proceeding, tests were needed to determine the extent of the cancer and whether or not it had spread beyond the prostate. We were dumbfounded, wondering how things could spiral out of control so quickly. This was our ground zero. We left the doctor's office armed with the biopsy report, brochures and treatments and requisitions for the bone scan and the blood work. The receptionist said she had sent in the requisition for the MRI, so it would be called when they had an appointment. These tests were necessary to determine the extent of the cancer and if there was any spread. We felt shell-shocked, and our thoughts were racing as we drove away. We pulled the car over as soon as we found an open spot on the highway, so I could use my cell phone to make appointments. We already waited long enough to get the bloody diagnosis. We wanted the surgery as soon as possible. Amazingly, we were able to book a bone scan for the next day. I called the MRI clinic, and they did not yet have the requisition, but they said it would likely be in November, a 3-month wait for the first available time. I began ranting, and I said that wasn't good enough. The clerk said if we paid privately, we could get it done in 2 days. So for $1,000, we could at least get him in on the surgery list. So that's what we did. I immediately called the doctor's receptionist for her to send the MRI requisition to the clinic where we would get the MRI. I told her they would take us Friday in 2 days' time if we paid privately, but it also depended on them receiving the requisition right away. Given we had both of these tests booked, we could then book the follow-up with the doctor for the results. For that, the receptionist said there was nothing available for 3 weeks. I complained again, and she looked back at the schedule and she noticed a cancellation for the following Wednesday. So in less than a week, we would have the results. Prior to the bone scan, my husband needed to get blood work to ensure his kidney function was healthy enough for the dye that would be used. I negotiated and problem solved for some of the incompetence I encountered from the obviously new staff person on the phone. I actually had to ask for the supervisor in one instance. The dye for the bone scan we were getting had to be on hand, and normally that took 3 days to be delivered to the lab where we were booked at. The person I was dealing with didn't pay attention to the fact that our appointment was booked at their main lab, the exact location where the dye was stored for all of their sites. If I had not been assertive and knowledgeable about working with the healthcare system, these tests would not have been booked so quickly. I thought about how often family caregivers have to strategize these kinds of problems in order to get any action. I was very frustrated, but thankful I knew how to maneuver through the system. The distraction of coordinating the appointments was a relief from the fear we were experiencing. Our son was only 19, and every ugly scenario flashed through our heads, but we had to work through it so that each of us couldn't end up in a dark place. We talked about our fears and worries openly. We approached this in a similar manner to everything we do, head on. Our family and a few friends knew about the biopsy, and we told them the diagnosis over time. It seemed to take forever to get the results, so people stopped asking, knowing that we would tell them what we knew when we knew it. But here's the thing. We had to study. We had to talk with each other. We had to weigh the options and understand this monster before we could talk to anybody else, especially our son. My job was to retrieve the science, to study, to decipher my husband's specific biopsy results, and to measure that against the options available and the evidence-based recommendations. I learned about the staging and the grading of prostate disease, about which I knew nothing about prior to our diagnosis. Initially, I was aghast. I wonder why I hadn't known any of this. After all, I am a nurse and a nurse researcher and a professor. I began my deep dive into understanding prostate cancer. I saw that as my role as my husband's caregiver. Whereas any serious health issue affects a family, prostate cancer is actually recognized as a couple's disease, but it affects a partner significantly as well. The numbers related to prostate cancer are actually staggering, but they double if your father has prostate cancer and triple if you also have a brother or an uncle who has the disease. Our information needs were tremendous. Even though I am a nurse, there was so much to learn about prostate cancer, my husband's particular case, and each of the options for treatments with all of the various risks and benefits. So I'll stop with that reading. You probably had enough. But I talk in my book about resilience that's needed, not just with prostate cancer, but any other condition, information seeking and how important that is for family member, and tracking our information and what we need. So I'll stop and open it up to a Q&A.
Thank you. That was great. I guess my first question comes from PROSTAID Calgary, because we have a resource library, and forgive me, I haven't researched where best to get your book from, because I think it would be an excellent addition to our resource library, because we encounter so many gentlemen who bring in their spouse or caregiver with them, and I think it would be a benefit to share that book with them.
Mm-hmm. For sure, and thank you. It's available widely, and I'll send you some links after our talk, so maybe you can share it with the group, and it might even be in the newsletter, but you can get it at Indigo, and it's in many Indigos already, and if yours doesn't have it, they'll order it, or any private independent bookstores. You have several in Calgary, Edmonton, there, or Amazon. You can get it on Amazon or through my publisher, Sutherland House, out of Toronto. So it's available anywhere. And it is
Perfect.
Called The Accidental Caregiver, Kim Fraser. There's another accidental caregiver book that came out years ago, not related to this, but if you Google this and Kimberly Fraser, you will find it.
Yeah, I think it would be a great addition.
I'll share details afterward. And
yeah, if you send that to Richard, that would be great.
Sure.
Okay, Kimberly, I am Antonio. We met at the meeting.
We did meet.
Yeah, exactly. Then, welcome. Thank you for your presentation. Very interesting. And I promised you that we were going to buy the book. And now I'm happy that Brad authorized that. Very good. Okay. Thank you for the presentation. Very, very interesting.
Thank you.
Dr. Fraser, it's kind of a cliffhanger. How's your husband doing?
Great. Great. It's been 4 years. So he gets the PSA test we had surgery, as you picked up. We had very extensive laparoscopic surgery, and the doctor was aggressive, which we wanted him to be. And his case, he was just at the margins. But as you know, if you're a surgery candidate and you have it, Doctor doesn't really know till they get in there. So he is coming up 4.5 years this June. So every June, I have the requisition because I'm the information gal, and I say, okay, go get this PSA. And he goes and we hold our breath until we get the results. And he has been very good for 4 years. And he has, and I think a 15% chance of this never recurring. And I chose to talk about that in the positive, because aggressive CA of the prostate, you don't mess with it. So he's doing very well. And our doctor said after 5 years, things even improve more. But I'm a nurse and cancer is ugly, 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 ugly. So I feel blessed and I take nothing for granted. So thank you.
Great, thank you.
So, I mean, he's doing great, but he still dribbles. I mean, so I say great. It's not that we don't have aftermath. So he still dribbles and he hates it. But I'm like, I'd rather have you like this than dead. So I'm very thankful that our doctor was very aggressive. I do not regret the surgery. Our best man at our wedding, when we called him to tell him about our husband, my husband, he in Calgary, and he had treatment at the Calgary Cancer Center. He was going through it and talking to me a little bit about his options. He had the radiation. He was a great candidate for that. He was not aggressive, but he had to have treatment. And he was 4 years ago. And since then I tell all men, just check your PSA, ask me anything. It's all open. It's all not wonderful, but it's all better than being dead, because you need to be treated. And men, this is as prevalent as breast cancer in women. So I'm a champion for testing and early diagnosis. David, hi.
Hi, Kimberly. Thank you for your presentation. I'm just wondering, how old was maybe you mentioned this and I missed it. How old was your husband when he was diagnosed?
I think 63 or 64. He's 67. Oh, he's 69. So I think his surgery, he was 64, turning 65. Yeah.
And can you tell me what the circumstances of his diagnosis was? Like, was it he had a digital rectal or he had the PSA or
sure.
both? Or...
No, he had the PSA test every year because his dad died in 99, and we knew it was metastatic prostate, and he was always, we always knew he checked his PSA every year, had the rectal every year. He's a pilot, so he gets pilot medicals, and we always talked to we had pretty steady physician care in terms of his GP forever. So it was always a thing my husband was paranoid about, and we always watched his PSA. So it was always normal. And his PSA went from one year, it was always low, low, low. And then it was 3. And because it doubled, still a very low PSA, the doctor called him in and said, I don't like this. I want to run it again. It was 3. So he had suggested the biopsy. And because of his dad's diagnosis, he had the biopsy. So he'd always been tested with his PSA. His PSA was never, I think at its highest ever, it was maybe 6. And he had aggressive.
Yeah, that's good. Yeah, we're fortunate in Alberta that we've got, the Southern Alberta Institute of Urology.
Yes.
Maybe you've heard of that. Started, the Prostate Cancer Center. Sort of another organization.
It's great, yeah.
A little bit different than ours, has a man van where we do PSA testing. And so I think in the history of the vans since 2009, they've tested over 61,000 Albertans and a few Saskatchewans with the PSA. So it's an important tool to pass on to to certainly any sons
yes
that you have, certainly have them get tested.
Oh yes, exactly. I talked to all my male friends, and my brother, I think my brother was early 50s when my husband was diagnosed, and he'd never had a rectal exam in his life that he could remember. And I'm like, oh, if you got a rectal, you remember it because no man wants it. But he had a GP forever, the same bloody GP. And I'm like, you go in there and you get a bloody rectal. But my dad died at 64, diagnosed with MS at 43. And we don't really know if it was in his family or if dad had any of that at all. So we didn't know, but I told my brother, I'm like, just go get bloody tested because you don't know.
Right. Yep. Thank you.
And shame on GPs for not doing rectals, and men for thinking there's something bizarre about it. It is part of a physical exam. And I talked to everybody about it.
Well,
Sorry.
Like Brad, I volunteer with the Prostate Cancer Center, hosting on the man van, and the number of men that I see that say, "Oh, my doctor doesn't do that. My doctor doesn't do
I know.
the," and I say, listen, not that you can, cancel your doctor or find another one too easily, but I would challenge your doctor to ask him, tell me what the alternative is. If you don't believe in the testing of the DRE or the PSA, what is your alternative?
Right.
And, challenge them on that.
Yeah, absolutely. Like, absolutely. And digitals are important because we feel things. And even though, and like lots of men have enlarged prostate, which is not cancer, and I tell them that, and it's still a pain in the butt to deal with, is not cancer. So, but, know your prostate. So like I tell women, know your breasts.
Yeah.
Yeah.
Good. Richard's been waiting patiently with his hand up. So
thank you, Brad. And thank you, Dr. Fraser, for your enlightening presentation. I enjoyed that. You can see that I'm in Calgary. I, like Dave, I'm a host on the Man Van with the Prostate Cancer Center. And I don't know how important it would be to you, but maybe to the other members of PROSTAID. I got an email today from a clinician at the Prostate Cancer Center saying she was starting a new project at the center called You Are Not Alone. And basically, they're going to have open meetings once a month, last Wednesday of each month, starting in April, for patients and their loved ones to come to like an open forum arrangement. So I just want to share that with you and with the rest of the group who's on here tonight. Something I'm going to volunteer to do and be there. I can tell my story. I'm a survivor of prostate cancer for over 10 years now. Touch wood, I've had no PSA reading for that long, which is, I'm very thankful for that. But yes, indeed. Anyway, I thought I would share that. And thank you again for your enlightening presentation.
Thank you.
Yeah, thanks, Richard. Yeah, Dave and I are meeting with Amanda at the center next week, and we'll be going through some of the programming offers that they're going through as far as their expansion. So as we get more information, we'll be sharing that. No questions in the queue, but maybe I'll interject, and this is a little more of a personal note. My uncle is in Manitoba and is in a care home. He's suffering from Parkinson's. And he's no longer able to talk on the phone. We used to phone all the time back and forth. But my aunt, his wife, he's my mom's brother. So she's been looking after him. Now she has her family there, but how do I support her?
That's a great question. Caregiver. That's very good, and good for you to be thinking about that. And I talk in my book, like I've met so many people that said, oh, I would have loved your book when my mom died, my dad died, my wife died, my husband died. And I'm like, well, actually, this book is for everybody, because we all need to be supporting other family caregivers. And so, like, I'm here because I'm in Alberta. I've been out there for 32 years, but my mom's alone. She's healthy. She's 85 and she's well and lives still in this big house that we all grew up in. My aunt next door is her sister, the 87-year-old with bladder cancer. My family are all nurses. They're younger than me. They're all still working full time. There's grandbabies. There's people are busy. So I came home, as did my sister from Wisconsin. So we're getting my aunt home from the hospital. So we're here to just do what we can. We're not here all the time. We're giving them, we're going to leave them a gift basket when we leave for my brother and sister-in-law, because they do all of the administration and the work. So we're going to send them out for dinner, a bottle of wine. I'm going to stay overnight, and as my sister overnight with my aunt. So, and we spent all day in the hospital. My sister-in-law is working. So that's what I can do here. I have friends in Alberta I know that are caregiving. I drop over, I say, I'm coming over for a visit and I'm bringing coffee. So I bring them things, and I talk in my book about how to support the family caregiver, because family caregivers won't ask for help. But we can say, okay, I'd love to see you. I hear you. I see what you're going through. Just tell me. So go and visit, no expectation, and bring things. In your case, if you're going to Manitoba, well, you don't want to be a burden on the family. You're coming to visit. So be prepared to what pizza outlets are in the area. How can you support a meal? Be there for your family. So I tell people to think about the practical things. What if that was you in their shoes? How would you support them? And call people. Talk to them. I had a friend of mine, we're about the same age. Her husband was diagnosed with prostate cancer the year after my husband. And we're friends, but we're not intimate, tight friends. And she called me right away through another friend and came over and gave me his PSA results. Because I'm a nurse, I could offer the skill. Okay, give me the lab test. And I dug deep and looked at it. And I knew the situation. My husband's, I think, Gleason score was a 7. Our friend Craig was a 9. And I'm like, oh my God, I looked at everything and I'm like, I don't know. I left her with hope. So leave a caregiver with hope. So I tried to leave her with hope, thinking this isn't so good. So I left her with hope. I've supported her through that journey by text, by saying, how's it going? Come over, have a coffee. But they lived an hour out of town. So I would always call her. Then, of course, like many people diagnosed with any kind of cancer, not just prostate, where can I get the fastest care, the best care? What's the best care? How many people do you know that looked at the States? I did. We were going to spend $70,000 for my husband to get surgery in the US, not because I was worried about the quality of care at all in Edmonton. I loved our urologist, but I was so scared about the wait times. And this was 2019, just before COVID. And I was just super worried, and I was open. So I tell people, be open with your health professionals, be open with your doctor, what you're feeling, what you're thinking. So my friend's case that had the Gleason score of a 9, diagnosed a year after my husband, he just died at Christmas time. He was metastatic by last spring. They're going to the States. And I knew how scary that was for her, because our husbands both had aggressive disease. So with the Mets, even people, your friends either come together or take off. So don't take off with your family and your friends. Say, this is crappy. What can I do? What do you need? And then when they don't know, because caregivers won't ask for help, that's when you show up with, you have to kind of be a little bit emotionally intelligent and sensitive. So show up with supper. If they love to see you, they can't get out because they're caregiving, they're busy, no matter what it is, they're intense with this caregiving thing. Show up with pizza, anything. You don't want to be a burden, but they need to know you're there, because a lot of people disappear because they don't know what to say.
Yep. No, I get it because I phone her regularly, like
Yeah,
at least once or twice a week. I phone
perfect.
her, and my last conversation was, I said, I don't know if I can get to Manitoba. I said, but if you're visiting him and he's having a good day,
Yeah,
send me a text and I'll phone you. And
exactly. That is good.
yeah, because she's doing everything
Yeah, that's
that
right.
she can.
That's right. And sometimes, sometimes there's not a lot of, it doesn't matter what you do. It can be little, it can be big. It doesn't matter. Just letting people know you're thinking about them. And even if they don't reply back, reach out again. They get your text, and sometimes they don't have time or call. So every situation is different. Just don't disappear.
Yeah, that's what I say. Just send me a text.
Yeah.
I'll respond to the text. If I can't talk, then in a meeting or something else, but I'll figure it out.
Yeah, absolutely.
Okay, well, I'm not seeing any more raised hands.
Well, you know where I am, and people, you can reach out to me. I don't know if my contact information was in my bio, but I will send a follow-up, and I can send links to my book. I also have another book called the Care Book that it helps track information. So because this is a practical thing I could give caregivers, because information management is huge. So I'm here, reach out.
Thank you so much for your time this evening. I know it's late.
Yeah, well, it's
you are
11:15, so but it's all
had a
good.
long day, so we appreciate that so much. Thank you.
I
for
appreciate
sharing.
the invitation.